Okay. Floor is
Louis,
yours,
we don't
Louis.
hear you now. I just stopped. Louis, we don't hear you. Hold on. He's talking to himself. Let me call him.
Yeah, he's not on mute, so there's something wrong with his volume.
Today we have one guest.
Okay, now.
There he goes.
Can you hear me now?
Yes.
Yeah.
I'm sorry. So I don't know how much have you heard. So welcome everyone to our health committee meeting from the community board 2. Today we have one guest that is going to be doing a presentation. There was another one that was pending, but it didn't go through it. Hopefully the person will be joining us in our next meeting. So we have Brett Scudder from the Scudder Intervention Services Foundation, and he's going to be giving a presentation about the suicide awareness and prevention program. So are you there, Mr. Scudder?
Yes, I am. Good afternoon, everyone. Good afternoon.
Thank you for being here with us, and thank you for coming to our meeting. So basically, you're going to be doing a presentation. So hopefully you can talk a little bit more about the program, how we can access the program, especially in this time of COVID, how the community resident can access any services, address, phone number, and so on. So the floor is yours.
Thank you. And thank you. Good afternoon, everyone. I know it's cold and it's freezing. So for those who are inside and at home, be grateful for that because it is not nice outside. But yes, so thank you for the opportunity. My name is Brett Scudder. I am the president chairman of the Scudder Intervention Services Foundation, the president chairman of the Suicide Institute, and the council, New York Suicide Council chair. We do a lot of work around mental health, but we focus specifically around depression and suicide because we realize that this is one of those topics that is not talked about enough, not addressed enough. And unless there's a celebrity that dies by suicide, we don't really hear suicide being talked about enough. Unfortunately, the Bronx, we cover all 5 boroughs, and the Bronx is where we've had the highest number of suicide cases, completion, and ideation across all 5 boroughs, 7 years in a row. And we know that COVID has now exacerbated the whole emotional state of a lot of people. And so we're expecting the numbers for 2020 to also be very high. We are local here in the Bronx, but we service, as I said, the borough. I also do work across the country, but I live in the Bronx. And so I'm happy to be a part of the Bronx community. We are a nonprofit organization. We have a 24/7 crisis response team that goes to meet people where they're at. Even during the pandemic, when there is no social distancing, we've always said that there cannot be social distancing in suicide prevention, because when people are in a state of despair and distress and they need someone to be there with them, we have to make that physical presence. We have seen a significant increase in depression, anxiety among our children and youth. We are trying to get more schools to do more awareness around suicide, but one of the pushback we were getting from communities is the word suicide is so heavy, they're afraid to touch on the word. Unfortunately, we're seeing more cases and hearing more cases of children, youth, and adults with suicide ideation, and unfortunately not enough being addressed because there is a fear that if we talk about it, then we will trigger people into acting on it. And that is not true. That is not the case. It is proven, there are facts out there that the more we talk about suicide is the more we'll get people to feel a sense of, okay, it's all right for me to talk about this. And so we really are impressing on more organizations, schools, churches, business places, wherever it is in the community board. I'm happy to know that the Health and Human Services of this community board has asked me to talk on this, because we need to get away from the mindset of suicide only being death. It is not just about death. COVID right now has been the trigger for a lot of people feeling a sense like, oh my God, this is either too much, or loss of a loved one, loss of family members, or even the fact that those who are infected with the virus are struggling so much that many of them don't want to live. One of the first suicide by cop cases that we heard about right after COVID was right here in the Bronx, when a gentleman found out that he had the COVID virus, and he went into one of the parking lots of a hotel here in the Bronx. He was acting out very aggressively and violently, so they called the police. And when the police came, he told them that he wanted them to kill him because he had the virus and he did not want to live. When they didn't want to do that, he attacked the police officers and they ended up shooting him and killing him.
Oh, wow.
That is what you call a suicide by cop. But not to think of the suicide, but think about what prompted him to act that way, for him to feel like he needed his life to end. And that was COVID. So we've seen a significant, increase in most companies. If you were to tell someone that you've seen a 500% increase in your business and workload, people be like, oh my God, that's great business. That's great for business. In our line of business, we've seen over 500% increase in suicide cases and mental health cases since COVID, and that is not a good thing. No one is looking at the 4 to 10-year-old children who are also impacted by the pandemic and are having major anxiety and depression, as some of them are dying, literally dying to get back into school, and some of them are fearful, so terrified of getting back into school. So there is a significant impact in mental health challenges that people are facing, and many of them, every time they watch the news or they hear on the news of a new variation or a new strain of the virus, people are getting more anxious, they're getting more fearful, and they're getting more depressed. And so this is not a clinical problem. I do a lot of work with clinicians and mental health practitioners. I do training for them on suicidality, the language and behaviors of suicide. So I'm training our healthcare workers on how to engage with people who are feeling suicidal, to understand the subliminal messages of suicide and what that response is. You don't have to be a clinical person to help someone who is thinking of suicide or feeling suicidal. And I stress on that because I am terrified every time I hear someone tell someone who is experiencing, emotions or deep emotions, listen, I'm not a social worker, I'm not a clinical person, I'm sorry, I can't help you. And we really need to get past that. Our biggest fear at the Suicide Council, which is something that we have been promoting, is that after this whole shock and awe of COVID, the worst is yet to come. We have not begun to see how bad this whole COVID pandemic is yet, because we're still in the shock and awe phase of 500 people dying, the risk of dying. And so we're constantly in a state of fear. And once we get past that state of fear, people are now going to start settling down in their homes and really starting to realize the breadth of how things have changed, and that we're not going to go back to a normal, quote unquote, normal lifestyle. Things will never go back to be normal. All the data right now is pointing that COVID is going to be with us for a very, very long time. And so we really need to be having more serious conversations in our homes with our children and our families around what this new lifestyle post-COVID is going to look like, and ask how they are feeling, what are their thoughts, and just their fears. So when you look at the state of where we are right now and how many people are struggling with depression as a result of this, and we ask ourselves the question, where are people going to go to get the help and the treatment that they need? And it's not always going to be in the emergency room or in a clinical setting. A lot of it starts within the home, within the business place, just in places where people get together and talk. So we're promoting more safe spaces for people to have conversations. On Mondays, Wednesdays, and Fridays, we have what we call We Are Listening emotional wellness sessions, where we allow people to just come in and just talk about how they're feeling, what they're feeling. Our suicide and depression support group on Mondays and Thursday nights at 8 p.m. and 1 a.m. A lot of people ask, how can you have a support group at 1 a.m.? Have you ever thought about how many people are struggling at nights between 11 o'clock at night to 5 o'clock in the morning with depression and suicide thoughts that have no one to talk with or nowhere to go. That is the highest risk of people, and the highest time of people with suicidality and depression is between 11 o'clock at night to 5 o'clock in the morning. And it's because of the loneliness that they feel, the isolation that they're feeling, because most services, most businesses are closed and now they're home. The only thing and the only place you can call at that time is 911. And let's be honest, how many of us have ever been in the emergency room and can say we had a pleasant experience in the emergency room? So imagine feeling depressed and suicidal and then having to call 911. What the experience of having 911 either come to your house or to be put in the emergency room, and what happens with that. So those are some of the factors that we're seeing in terms of how COVID has really created this real existential threat that we're now facing with increased numbers of substance abuse. A lot of people are self-medicating to deal with this COVID pandemic. Alcoholism has gone up. Substance abuse use has gone up. You talk about domestic violence. We have a lot of people who are isolated and locked down at home with an intimate partner who is very abusive, very aggressive. A lot of people are talking about, I'd rather kill myself than to be here locked down with this person being abused over and over with nowhere to go. A lot of fear in people because people are still out here taking this pandemic very lightly, not wearing a mask. And those who are very fearful of their lives are in a panic because they don't want to go out and be around people who are making them feel less safe or at risk of catching the virus. So believe me when I tell you, over the 20 years of doing the work that I do, I have never felt more terrified than I am feeling since this pandemic about the state of wellness that we are living in and we are feeling. Worst of all, we're now in this cold period. We're so cold and people are again forced to lock down because can't go outside, can't go in a park, can't be, just to get out to get some fresh air because it's either too cold, it's a snowstorm, it's safe to risk being out. And so more reasons why people are feeling overwhelmed and stressed out. I would love to present to this group at another time when time permits a presentation that I do across the country called The Process of Suicide from Ideation to Completion, because we need to get away from the thought of suicide being death only when someone dies. Suicide is actually the thought process that a person goes through when there's a disruption in their life. They get away from this happiness, place of contemplation of just feeling like my life is good right now. Everything is good. Look how many people have lost their jobs. Look how many industries have been wiped out. Look at how our school system have been disrupted. Look at how our social lifestyle has been disrupted. All of these are triggers for a lot of people to be feeling overwhelmed, stressed out, and not wanting to go on anymore. When the pandemic started, people thought it was going to be a short thing. It was only going to be a couple of months. It was going to come and it was going to go away quickly. Here we are now into our 1-year anniversary of it. 500,000 people have died, and it doesn't seem like we're getting a handle on it. When we were looking for the vaccine to come, the vaccine came, and now the vaccine has presented even more stressors for people because some people who have gotten the vaccine have actually contracted the virus after getting the vaccine. Some people have had some serious side effects. So there is a lot of fear in people about taking a vaccine that ultimately should prevent them from catching this deadly virus. So the realities are very real. One of the things that we see that is also a trend that we're telling parents to be very mindful of, be careful of the conversations you're having as parents around your children. Because the children are there hearing parents talk about their fears and all these different things going on with the virus and the pandemic. And the children are not understanding clearly, but they're going based off of the fear that they hear their parents talking about. And so we have 4-year-old children who are telling us that they don't want to live anymore because they're tired of hearing their parents talk about how bad this condition is and how much fear they're hearing in their parents. 4-year-old children. Now, 9 years ago, we were starting to see the first set of children under 5 with suicide ideation. But since this pandemic, we have seen a significant increase in children between the ages of 4 and 9 with suicidal behavior and suicidal tendencies. I'm saying this because I need you to understand, ladies and gentlemen, that this is not about the teenagers or adults. We are seeing suicidality across the board in children from 4-year-old to seniors. This is a very serious state that we're in. How many times have you heard about suicide on the news lately? Anyone? How many times have you ever heard about suicide on on News 12, the Bronx?
None.
What if I told you that there was a suicide here in the Bronx even today, yesterday, the day before? Did you hear that on the news? Was that reported on the news? So there isn't reporting being done on the real numbers and the real cases of suicidality that are happening. But if it's a celebrity or some popular person, of course it's going to be covered on the news. So a lot of times people say to me, "Oh my God, Mr. Scudder, you know, we're glad that this suicide thing is not such a big issue," just because they're not seeing it and hearing it on the news. But it is happening every single day here in the Bronx. Every day, more people are losing themselves to thoughts of hopelessness, isolation, and loneliness. More people are just thinking like, I really don't want to be here anymore. And many have ended their life. Now, let me be very clear on one thing that we're really starting to get people to understand. It is very unlikely that there's an accidental death. An accidental overdose. And when I say unlikely, it's because when you think about someone who is in a state of despair or just feeling a sense of overwhelmed or for whatever it is, who is taking whether medication or excessive alcohol to treat how they're feeling, it's not an accident that they overdose and die. It's because they're already experiencing pain and suffering that they were using the substances as a way to self-medicate, why it became an accidental death. So the question that we have to ask ourselves as a Health and Human Services Committee is, what can we do in our community to bring more awareness for people to realize that it's okay to talk about their emotions. It's okay to talk about how they're feeling. And even if they're thinking of killing themselves or wanting to die or not wanting to be here again, it's okay. It is okay for us to have that conversation. It's okay for them to say that they feel that way, because that's really when we're going to be able to get them the help needed and be able to help them to understand whatever it is that they're going through and connect them with the help and services that they need. If we approach this from a fear perspective and still being fearful of talking about this, we will never be able to get a handle on this or ever be able to get people the help that they need to not kill themselves. So many lives have been lost by suicide. And I work with a lot of families after the loss, and sometimes listening to their stories, it breaks my heart because there were signs there before that if paid attention to, a lot of times this person could have gotten the help. This person was expressing subliminal messages that they were not picking up as messages. Things like, no one understands how I feel. When you hear a young person or a youth or a child say that, ladies and gentlemen, we need to pay very close attention to that, because that is one of the most common things that someone says when they're in a state of pain or depressed or overwhelmed is, no one understands how I feel.
Yeah. I'm sorry. I've been having issue with my audio. Sometimes I hear you, sometimes I don't, and I feel bad because the information that you're giving is really, really, important, especially during this time of COVID. But I have a question for you. because this is something that sometimes you can see the signs, sometimes you cannot see the signs.
Yes.
And you know, when you see the signs, sometimes it helps, but sometimes, you know, people don't pay attention. But my concern is that when you don't see the signs, how can we help? How can we see when someone is thinking about it, is thinking about to kill themselves? It's so hard. And although right now, like you were saying before, I mean, this COVID time where, you know, everybody is in their houses and the frustration and not being able to even go outside or whatever, it's being really bad for some people. So how can we identify when someone wants to, you know, kill themselves, but you don't have a sign?
So thank you for that question, Louis. Thank you. So remember what I said about creating those safe spaces for people to be able to express how they're feeling, right?
Mm-hmm.
It's not just a physical space. It could also be a virtual space. It could also be letting people know that there's a number that you can call or this person that you can call. The biggest fear of someone who is feeling suicidal is, what will your response be if I tell you how I'm feeling? That is the biggest fear. So while there are many people who appear to be happy, as you said, you don't see the sign or you won't see the sign. Someone wants to share with you how they're feeling, but they're so afraid of how you're going to respond that they would rather suffer in silence and kill themselves than seek the help. So the question is, how do we respond to someone who is expressing that they want to die, they don't want to be here anymore? How would we respond to that? And what would we do? Because that is a big part of the conversation, Mr. Lewis, is for us to say that we are understanding that there are people hurting out here and struggling with everything going on with the pandemic, and we're creating a safe space for them to know it's okay. If you just want to express how you're feeling, you're not going to be judged. No one is going to label you. We're not going to press the panic button and say, oh my God, just because this person talked about killing themselves, we're going to rush this person to the emergency room and it's going to become this whole big thing. All right.
Mm-hmm.
We have to be very careful of that because that's what a lot of people fear. I'll give you a personal example. I went in for a PCP appointment at North Central Bronx earlier on last year. I had severe headaches that sometimes was blacking me out. I didn't know what it was. It started up suddenly. Severe headaches. I went in, I told my PCP that the reason why I was coming in was because my headaches prevented me from working. You know, my work is about thinking and a lot of deep thinking. So as soon as, my headaches were just past a migraine. I went into the hospital. I went for the PCP appointment. They gave me this form that is called a PH9 form. How many of us have ever gone to the doctor, right? And they give you this form. And on the form, it asks you, have you ever thought about suicide? Have you ever felt depressed? Right? That form, right?
Mm-hmm.
So I filled out the form, and I'm a suicide attempt survivor. I've lived the experience with suicide, and so I filled out the form honestly, the way that we want people to be able to be honestly sharing how they're feeling. So the nurse said to me, she said, Mr. Scudder, are you sure you want to answer the questions the way you answered the questions? And I said, yes, that's how I'm feeling. That's what the question asks. She said, okay, I'll be right back. She inputted data in the computer, and she said, I'll be right back. 2 minutes later, the door opens. There are 5 people standing at the door. 1 security guard, 2 doctors, the nurse, and another person with a wheelchair. And they're saying that because of me filling out the form the way that I did and what I said on the form, I was now considered a high risk for suicide and was rushed at North Central for emergency services.
Mm-hmm.
And Mr. Cutter, my name is Roberto Crespo. I'm chair of the community board. First of all, I want to thank you on this presentation, as small as it may be. As small as it may be, I think that everyone that's listening in right now has expanded their minds tremendously on what you're speaking about concerning the suicide. I think we all know of, or we've heard of people saying some of the words, not doing it, but hearing some of the words that you have stated here. And so I want to first thank you on that. And I believe that is the problem, what you just stated when you filled out that form. People are scared to fill out that form or agree to what it's saying because you want to be as truthful as possible. But then the ramifications that occur after that is the issues that everybody has to deal with, you know, especially, you know, those people that were at Monty, they deserve to be analyzed more than you, because everybody's going through this COVID situation, you know. Everybody, you know, you get that caged in feeling because you can't go out, you know, and one day gets nice and everybody wants to go out, and then everybody's crazy when they're going out and things occur, you know. That's how I happen to see some of the things that happen with police and some of the things that are happening, blacks on black, black on brown, brown on black, whatever it is, because people for one day have this liberty that they go out and they don't know how to accept it and express it, that they can enjoy it. And so it's taught me quite a bit. And the one thing that it might be a question, but it's more of a request. How is it possible that we could get that study that you stated that that suicide among kids have gone up approximately 500%, or the attempts?
All right. Thank you, Mr. Roberto. Thank you for that. So the 500% increase we're seeing is here at the Scudder Intervention Services and the Suicide Institute.
So how can we get, is there a possibility that we can get that study, you know, some way or another, you know, so like that we can maybe share it with other board members, or for us to review with our education committee also? I would love for you to make that presentation at our education committee, because they deal with our kids.
Yes.
In our school.
Yeah. So the 500% is what we're seeing in terms of the numbers. We have been, so Mr. Roberto, we have a 24/7 program. I had 2 critical reconstructive surgeries in 2020 that I had to work right after surgery because people were begging me to come back to work because of all that was happening. We have not even had a chance to breathe yet to aggregate the data. All we're going off is a number of cases that we're seeing and keep counting the cases as we're seeing and realizing that, oh my God, this has really been overwhelming to the point that our numbers are just going up and up. Our support groups have more people. Our emotional wellness sessions have more people. Our social media is getting more. So that's where we get the 500% increase from, is by seeing how many more people we have heard or seen reaching out to us or engaging with us. But also there are other reports across the country that have talked about the increase in suicides and depression and substance abuse since that. Those data are also available. We have not been able to aggregate our data yet because we're still actively dealing with so many cases and just trying to deal with them. We're not the type of organization that someone can call at 4 o'clock in the afternoon on Friday and say, I'm sorry, we're closed. You have to call us back on Monday. We're not the organization where someone will call and we'll be like, I'm sorry, it's either too late or it's something we have to get back to you. Our line of work is 9 out of 10 calls that we get is from someone who is in crisis and really needs help, whether it is that person directly or a family member. And so that number is our number. We will be sharing more breakdown as we go, but we have just been going, Mr. Roberto. It is mind-blowing.
I can imagine what you're going through because, you know, we don't see it on TV, like you said. We don't see it on the news, but we all hear of it some way or another, you know. It's come to points at times that people tell me so and so died, and I'm already assuming it's from COVID, and I hear no that they took their lives. You know,
Yes.
and so I know that you must be going through a lot. But is there then if we can't get the report, I would like to know, is there a flyer that you may have that you could share with Lewis with some of the bullets that you just spoke about, and we can share it within our system throughout all the programs that we have, all the schools that we have on our mailing list, so like that people can start seeing that these are the things you need to, because even though a teacher may be smart, but a teacher doesn't see the signs. A mother may work in a hospital or a clinic, but doesn't see the signs. I myself, like I said, I've learned a lot in just your few words. So I would like, if possible, if there's a flyer with your number, this Friday, what is it? The emotional support that you do on Monday, Wednesdays, and Fridays, with a number, that people can call, because you're doing it, like you said, at 8 o'clock at night and at 1 o'clock in the morning. And most times, I used to be a correction officer. And so at most times when suicides did occur, it occurred after they were locked up and it was after 11 o'clock. So
Right.
I've seen it happen. So that's why, I would like to see how we can possibly at least get a flyer and we can put it out through our mailing list and our package that we send to our board members.
And also, Mr. Crowder, I'm following Bobby's question. We're talking about young people right now, but this is something that is affecting everybody.
Right.
But I have a question. How do you reach out to young people? Do you use social media?
So we're very popular in our work, and so they come to us because a lot of the schools promote our work. Our flyers are in a lot of schools in different places. I will be sending Miss Baez, who had reached out to me from the community board. I will be sending her because that's the person that reached out to me. So I will send our flyers, our events that are happening with the suicide and depression support groups, the We Are Listening sessions, a flyer that we give out that talks about subliminal messages and what those subliminal messages are. We're going to send you our crisis response flyer as well that talks about. So we're going to send you, don't worry, you're going to get information from us that will be very helpful across the board in not only understanding this, but also being able to promote the resources needed for this. But let me also get back to one of the things that Mr. Roberto said. I want us to really just think about this as being anyone on this call right now could be in this state. You understand what I'm saying? Anyone on this call right now could be in this state and you don't know. And the reason why I say that is because a lot of times we are focused on everybody else and not thinking about the circle that we're in, right? This health committee and focuses on the health for the community, but is this health committee also focusing on the members of the committee? And I say that it starts within the membership of the committee to see how we can be supportive of each other before we can even take that out into the community, because we have to speak the same language. We have to have the support system within the committee for then us to take it out. And so how do we set that precedence here as a Human and Health and Human Services Committee to say that Bronx Community Board number 2 is promoting health and educational wellness by saying it is okay to not feel okay or be okay. And if you are feeling overwhelmed, we understand what that is like, and we would love to hear from you. We would love to be that listening ear to hear and connect you with the services, because that's how the language changes, right? Not to tell people EMS or 911, to say we are the ones who are willing to at least listen and connect first, and then say, you know what, together we can get the help that you need. Many of us are too quick to say, oh, you know what, this sounds like too much for me. Now you need help. You need professional help. let me tell you something. Since COVID, we have had more clinical people, more educators, and more people coming to us for help because they too are affected. Imagine how many of our clinical people are overwhelmed because of everything going on, and everybody looks at them as the provider, but not looks at them as human beings who have a family who are living the experience too. So we have been providing counseling and support for clinical workers, EMS workers, people who are on the front line, because too often we don't think about them as being the ones. You talk about correction officers. You imagine what's going on across the board. Every one of us at some
We have
point.
Julia with a hand raised. Oh, I'm sorry. Mr. Scott. I thought you was done. But Julia has a hand raised, and I think Cynthia has a hand raised also. Cynthia
Go ahead, Miss
physically has a
Cynthia.
hand raised,
Miss
but
Cynthia, I saw Miss Cynthia.
Is also with a
No, go ahead,
Cynthia.
Julia.
Cynthia.
Julia was waiting before.
Yeah, thank you, Cynthia. Thank you. I wanted to bring up that I am a licensed social worker, in LMSW, and I do work in a nursing home. So almost 29 years. So I saw COVID head on. I held I held people's hands while they died because the families couldn't be there. So just to piggyback off what you were saying, I did experience that. I don't want to say depression, but that sadness of telling families I'll hold their hand until they die because I know you can't be there. And I did. I reached out to a lot of people because I felt myself getting sucked into the whole COVID and deaths and families, you name it, I experienced it. I spoke to the community board, and you're absolutely right. There are times we talk to somebody and it's not, what do you need? They'll come out with me, but
Right.
nobody really, I didn't feel anybody was really listening to me. And I brought it up in all corners of the earth. I brought it up to in health. I brought it up in full boards. I brought it up to the police department. We saw other people getting celebrated. People were clapping, and no one ever really did anything for us. So I took the role out of, I'll heal myself later. I'll deal with all this later, but I'm gonna help my coworkers, the nurse aides, the nurses, the doctors. So I would every day like make sure that they were okay. And then I would turn around and go, I'm gonna take care of myself later. So I've learned techniques of, self-healing, of, you can't always go to people because you know that they have their own issues, and you know that they're gonna, if you tell them I have 14 karat gold, they're gonna tell you I got 24 karat gold. If you have a headache, they got a migraine. So I know you're laughing because you
It's true.
hear that
No,
all
it's
the
true.
time.
Yeah.
When you're looking for that support, you don't get it. And I just tell myself it's up to me to take care of me. So I do a lot of interviews regarding, because I do work with the elderly population, and that's one of the populations that are growing in suicide. They have figured out a way of doing it. So I work a lot with them, and I do pick up signs. And I realized in all my years of doing social work, which is probably about 40 years, listen, just listen, meet them where they're at. It's not about you. It's not about your experiences. Meet them where they're at. If they think the sky is gray, why would you argue with them? Let's just go and see where they're at. So to me, the key is listen. And then when you finish listen some more, and then listen some more. And if you didn't know the signs, you will pick up the signs. So I just wanted to also inform you that I did have that experience, that as a clinician, as a healthcare worker, as a nursing home worker, yeah, I felt I had nowhere to go. And I did try, but I
Yeah.
felt I had nowhere to go.
Yeah, true.
Thank
So,
you,
Miss-
Miss Julia. Thank you, Miss Julia, because I mean, at the end of the day, we look up to you as the one who's helping everybody else, but not the one who needs help. You know what I'm saying? And unfortunately, that's why the industry is going to suffer. And this is why I'm trying to tell people we have not seen the worst of COVID yet, because
Right.
all the healthcare workers are so stretched out. There have been a number of people who are studying for healthcare who dropped out of healthcare because they said after seeing how society responded to COVID and how healthcare workers were thrown into it, many of them decided to no longer pursue being healthcare workers. So, we're dealing with some really serious issues, but thank you for sharing that. And, I'm glad that you found ways to deal with it for yourself because, not everybody was able to do that. So I'm glad you were able to do that for yourself. And thank you for all that you do.
Yeah. So Mr. Coro, I have another question.
I think Cynthia
Guys-
had a question, Louis.
Who-
I'll go after you.
Cynthia.
okay, go ahead, Cynthia.
No, no, I'll go after you. Don't worry about it.
No, you're important. Go ahead.
I have a quick question. Saying that when you filled out the forms in the hospital, their response, what's the difference between what is the difference between the hospital's response and in when someone fills out a paper saying that that's how they feel? Do you automatically call EMS on them? Do you automatically okay, so what's the difference?
So the difference is when someone expresses to us that they're feeling suicidal, we're like, okay, thank you. Thank you for sharing this. Thank you for trusting us with this truth that you're going through. Can you tell us why you feel this way? So we have a conversation with them. You cannot take away the person's strength just because they say that they're feeling suicidal or thinking of suicide, because you don't know how long they've had that experience, right? It could be sudden or it could be over a period of time. But if you rush to judgment, you could ultimately put that person at more risk by rushing to judgment or making that quick decision to go to EMS. So have a conversation. Ask what happened and why you feeling this way. Let the person know, look, I'm interested in listening. I don't have all the answers. I may not have all the answers, but right now this is about you. You've shared something with me that is very, very important to me. And let the person know that you feel the importance of spending that time listening. That's why we are listening sessions, not talking, listening. I've been with people who are suicidal for 4 or 5 hours, and believe me, I don't know their name. I don't know their name because their name is not important. What is important was that they reached out to me because they said they were feeling suicidal. They didn't want to live anymore. And I recognized that they were in pain and I wanted to understand the pain. And so we were having conversation and they're spilling out their whole life. And as terrified as it sounds, like they really want to die, I hear in their voice that they also want to live. They just want to get rid of the pain. They just want whatever the stress or the pain is to go away. Or someone, just one person who is willing to at least listen and validate that, yes, you know what? Oh my God, I cannot believe that's a lot of pain that you're going through. So in some cases where you find that the person really is deep in that despair, a lot of times the breaking point for them is just connecting with you. It's not saying I'm not a professional, I'm going to have to refer to 911, but you may be the conduit. You may be the one person that really changes that person's thought process about that suicide.
Mhm. Yeah.
So true.
Yeah. So Mr. Coro, I have a question. So what recommendation you can give, our committee what to do to assure that the people can create or that we can provide those safe spaces? Because okay, besides the information that you can provide to us that we can give to the community, we can put it in our social media, we can send it via email. What else do you recommend we can do? Because maybe there's a possibility that we're not going to be consistently providing all this information.
So again, Mr. Louis, you don't have to be the one providing the service or stuff. You could be the conduit to the service, right? So let's say Bronx Community Board 2 now said in one of their newsletters or to the community, we recognize that there is a high increase of suicidality during this time. We understand that people are hurting and that their pain is real. And we want them to know that this is something the community board takes very seriously in listening to the constituents and their stressors and the way that they're feeling to be able to help support and connect them with additional services. that right there, that pitch right there will say a lot, because at least you are calling out something that is very, very prevalent right now. Like, we need to stop acting like suicide is not a crisis, a public health crisis, but also saying that we're willing to work with entities, whether it's your clinical people in the community, the private practices in the community, schools, business places. This is a community board health crisis that you're garnering this collective to address.
Okay. Does anyone have another question?
Yes, I have a question. Mr. Scudder, thanks for the presentation. You mentioned like another formal presentation. How long is that other presentation?
Usually an hour and a half to 2 hours. It has to have time for us to go through, because when I do the slides, usually it really generates a lot of conversation, because you really are giving a knowledge to people that really will trigger their thoughts. So an hour and a half to 2 hours is enough time for that to be effective.
So that's more a training.
Okay, and then yeah, that's like a training, I guess. And then
Yes.
regarding like any flyers, materials that you have, the way you just described how Bronx Community Board 2 will always be vigilant when it comes to this. Do you have any material? You saying you're going to send it to Ms. Baez, but if there's anything in particular that you want us to blast, just make that as a point of reference so that we can advertise that on our social media, and we can also send it to like board members, even if it's like a hotline number or anything like that. That's what we would want to get out, immediately if possible. Thank you.
So when I send the information to you, you could take that information. What a lot of communities do is they take our flyers and they send it out to their mailing list, and they say, look, we know, Mrs. Scudder, the work that they're doing, and we've partnered with this organization to provide the services for people who are feeling a sense of being overwhelmed, suicidal, whatever it is. And when they send our information out, we get people calling in and say, hey, I got your flyer from our community board, or I saw it in one of our buildings or school or whatever it is, and we're happy to know that this information is here. I need your help, and that's how we get the word out. So we to be honest with you, we stopped promoting our services because we are just out there. So many people tell us that they see our flyers in a hospital or a school or their elected official offices, because we do work with a lot of the elected officials. We were also part of, just as a note, we were also part of this new legislation that was passed in the state in the late part of 2019, where we put pressure on the Office of Mental Health. We know that in our Black and Brown communities, mental health services is not the same as in affluent communities, right? And so we were part of this new Suicide Prevention Act that was signed by the governor in late 2019 that says that the Office of Mental Health has to review the mental health programs and who they're funding for mental health services to be more culturally competent and serving our communities of color. And I'm very proud of that, because we need more culturally competent services in our community of color when we're looking at this heightened increase in depression and suicidality going on, and a lot of clinical people who are still not able to address that in ways that they should.
Ralph, you finished?
Yeah, I'm done.
Okay. And I know that time is getting short, but Mr. Scudder, I want to go back to what our district manager was asking about the training that you do, or the workshop, whatever wording you want to call it. I want to know, I need to work with my district manager as well, with Louis and with Cynthia, to set up a date, if possible. I like to have like a full board meeting, but not a board meeting. Assign it to a certain committee and have just you as part of that presentation for that committee. and I think it would be probably the education, since you're on the health committee. I think I'll do it on the education side, and I need to speak with Ralph and with Cynthia and with Louis, because I would like to have all the committees and just do a big blast that, you know, have people probably sign on and they can hear what you're saying. Because we have principals that are they're not members of the board or were members, but they're still active with the board. We got parent coordinators. We have like Julia. We have Jennifer Kelso, who's online now. She has an adult daycare center here in the district. Maggie, who's always going around working with people in the community, and Pascual, and so maybe, and we even have the chairman of the advisory board of Lincoln Hospital on our board, and have everybody on so like that they can hear this, because honestly, I believe, like I said, your little presentation right now opened up my mind to a lot of things, and so I need for that to happen, and for us to be the advocates that you're stating at this time. It's the only way that we could possibly do it. It's not a board meeting. It'll probably be a workshop, but I can get everybody on. I know that we also do a retreat in sometimes in late June, maybe early July, but I don't know if I want to go out that far. That's why I say I want to talk with Ralph and with Cynthia, you know, to see what we can do about that.
Well, I mean, you know, to be honest with you, I'm so glad to hear you say that. You don't know, I'm ecstatic to hear you say that, to be honest with you, because you recognize that this is not just a health committee issue or education committee issue. This is like a whole community issue. This is why when I had said at the beginning, like, this is a collective that you're driving from the community board to bring the community together. Because if someone is feeling overwhelmed, you want that person to be able to walk anywhere in that community and connect with someone who will be able to be that first response, right? So it could be a business place, could be a nursing home, a daycare center, a hospital, school, wherever that person is and feeling a sense of being depressed or suicidal, that person should be able to, you know, grab onto someone or say to someone, you know, right now I'm just really, really feeling overwhelmed right now. And that person should be able to at least have the basic knowledge of, oh my God, I recognize that this person is in emotional pain and thinking about hurting themselves. I can at least have that conversation. So I'm glad to hear you say that, because that's what we need. We need this to be a community collective. Because as I said, someone on this call right now could be feeling that way, and we still don't even know that. And that person may just be needing to hear that this is something that can be addressed in the way that it is.
Yeah. And even let's go even further. Maybe our children, our brothers.
Yeah.
Yeah.
It could be our family members, you know, that we hear it. You know. How many, you know.
And that's why I said, once we make it a community collective, the community board now becomes the precedence of leadership in this, not from just a health perspective, but just the community board. Remember, you represent the community. So you aggregate all these different resources within any community, and now you're leading this charge. This is going to be powerful for community board too.
Yeah.
Thank you, sir. Thank you.
And can you give me, when you send us that email or that flyer, it would be good, because when I complete my minute, I can add that as a supporting information. So the community in general can have that number as well. So if there's any, okay, can you give me a phone number where we can contact you? Because maybe you said in the beginning, but I've been having issue with my sound. It's going back and forth.
So what I'm going to send to you, Mr. Lewis, what I'm going to send to you is our organization flyer, as well as our hotline flyer and some other promotional tools. you will be able to take whatever you need from those and use them as needed. So whether it's just to promote the hotline, or it's to just have our information, you'll have all the information you need about us, as well as some educational information that you can also send out to the community to say, hey, here are some things, here are some tools, here are some tips that you can use, or that is available for you deal with that.
All right. Thank you very much. This is a really great presentation. I know I can see everybody you making them think. You can making us think. You put into that deep process. So thank you very much for coming in. Hopefully this is not going to be the last time. It's going to be more times, and let's see how we can connect in a way that we can work more and provide more information to the community. Yes.
And let me also add on to, I am familiar with completed suicides in your community board district. So this is something that I'm very familiar with in that community board 2 area. So you do already have cases of this already happening. So, you know, it even behooves us even more for this to come out and this to be done from the community board.
Thank you, Mr. Scudder.
Thank you. So if there's any more questions, I just request a motion to end the meeting.
Any old business first?
Oh,
Yeah,
I'm
hold
sorry.
on. We got an announcement here, so we can
Sorry.
get to old business, new business, really fast. I know we're pressed for time.
Yeah, any old business.
I doubt it.
A new business.
Ralph, only on new business. Maybe we can all talk about this presentation today, okay?
And we have to include Julia with those conversations. So
Yeah, oh, definitely.
and Jennifer, if anything. But we
Yeah.
have announcements, Louis. Just is on the agenda here. Just for
Yes,
seniors that need access transportation to get vaccines. There's a hotline number they can call, or they can actually go online to set up an appointment and to see what trips are eligible and what's going to be appropriate to work. So we just want to make sure that everyone's aware of that, and I'm sure that Cynthia Danielle has blasted that out. So Cynthia did a good job with that.
Yeah, that's good.
That's my only announcement here.
This is really good.
All right. Do you mind if I leave?
Oh, we're done. Thank you very much.
I know you guys your community.
We're gonna
business.
leave before you. We're gonna leave before you. So
We're gonna together.
Motion to
Wait.
adjourn.
Motion.
No, wait, we have one more announcement. Tomorrow we have our special events committee. So we're gonna be tomorrow at 12. I'm going to send out I'm sending everything out again today. It's for the care packages giveaway this Saturday. Everyone that's going to be attending the event should get online on this meeting because we need to explain the do's and don'ts of the event.
Thank you, Cynthia.
Okay.
Okay, that's it.
Motion
all right,
to
cool.
adjourn.
Thank you.
Okay.
Good night, everyone.
All right.
Bye bye. Thank you.